What is schizophrenia? That's what I'm talking about today. Subscribe if you don't want to miss an episode. It goes beyond hallucinations to be the most severe psychiatric illness possible. Schizophrenia is the most severe form of psychosis. It's impossible to distinguish between reality and fantasy. In psychosis, schizophrenia is more than just believing you're the best at soccer. For example, that's just a subjective belief. Schizophrenia has multiple symptoms. Delusions, which are false beliefs that the person cannot be convinced are wrong. A hallucination could be something like your spouse having been duplicated from a skin tag on your calf. A skin tag can be removed from any part of your body. However, auditory hallucinations, which involve hearing things that aren't there, and visual hallucinations, which involve seeing things that aren't there, are more common. These hallucinations typically occur when you're alert, awake, and clear. They are different from the hallucinations you might have when you're sleeping or waking up. People usually notice this by the way you talk when you have disorganized thinking. It may seem logical to you, but not to the other person listening. You may only answer questions partially related to what the other person said. It is possible for people to say that you are speaking code because what you say sounds related, but is not fundamentally the same. Another way of experiencing this is having your thoughts get derailed, causing you to switch from topic to topic as you talk. We call this tangential thinking. When the trail off doesn't lead to the original point, though the topics may seem closely related to you, even though you think the topics are loosely connected and make sense to you, to the listener it sounds like you are just meandering off topic. Some people are naturally talkative and explain their stories in great detail. This is called circumstantial speech or thinking when you get off topic but you can get back on track. In schizophrenia, circumstantial speech is not associated with a thought disorder. An additional symptom is a disorganized behavior. In other words, this is more than having a cluttered room. It is a major level of disorganization that interferes with functioning on a day-to-day basis. One way it can appear is that the person has outbursts of agitation. I've seen people smear their feces on the wall. It's common to laugh out of nowhere. However, this isn't always caused by a funny video you watched. The last manifestation of schizophrenia is negative symptoms. This is harder to diagnose because you find yourself laughing and disturbing people when you have no thoughts. I called the first 4 symptoms I listed as positive symptoms. A way to look at the negative symptoms is to think of them as things that are abnormal and that one doesn't respond to environments in the usual way. They are also things that one does not notice about themselves. Others will notice that your facial expressions have drastically reduced, or that you haven't made eye contact or started moving or talking. People without a mental disorder find it hard to sit without stimulation for extended periods of time. The 5 symptoms are people who need sensory input in any form, like having someone talk to them, touching them, or reading or listening to them. But those with negative symptoms require much less of this. Therefore, you can sit and do nothing. These 2 symptoms must occur simultaneously for at least a month. I don't want you to think, I have a disease already. I want you to think, I don't. I heard someone call my name last week. Does that mean I'm schizophrenic? No, not just from that symptom. Considering schizophrenia is so disabling, you shouldn't have a hard time finding 2 of these things you did in the past and questioning if you have it. Delusional people lack insight and have cognitive difficulties. They don't recognize that they're delusional. The symptoms last for a couple of hours before you realize it's a delusion. People with schizophrenia do not experience constant voices talking to them in the background, but Their ability to ignore those voices depends on the volume and what they're saying. The presence of voices has comforted some patients, as long as they didn't say mean things because they didn't feel alone. This is in contrast to someone who bangs their head because the voices are too overwhelming for them. Cognitive deficits are another trait of schizophrenia that distinguishes it from other illnesses where psychosis is present. Cognitive deficits include memory problems, life planning, and organization issues, and impaired thinking abilities. Bipolar disorder patients who become psychotic and those with schizophrenia show several differences. A person with schizophrenia will not exhibit prominent mood symptoms of depression or mania when they are in a psychotic state when compared to a person with bipolar disorder. The delusions of a person with bipolar disorder are usually matched with their mood state at the time. If they're depressed, they may have excessive guilt themes to them, like they don't deserve to live or they've broken some societal norm. As opposed to schizophrenia, a person with schizophrenia will have mood-neutral delusions, that are usually, though not always, bizarre. An example of a non-bizarre delusion would be the belief that all health care providers poison their patients. A psychotic person with schizophrenia will also have a history of lower functioning, such as serious academic problems or the inability to keep a job. During an episode of bipolar disorder, the person may have a higher functioning level than prior to the episode. It is true that depression can result in thinking problems, Alzheimer's disease-like memory problems. Imagine schizoaffective disorder as the combination of schizophrenia and bipolar disorder. As a result, you experience mood episodes, but you also have psychotic symptoms in between the mood episodes. Accordingly, schizophrenia is not episodic like depression or bipolar disorder. It is more constant. Symptoms may rise and fall, based on a variety of factors, but there isn't a prolonged period of no symptoms. So establishing this as a diagnosis is very complex. You can probably see the many nuances involved here. It's not intended to diagnose oneself, it is meant to provide more information to help you understand your illness. Once it has been diagnosed, we're not sure exactly what causes schizophrenia, but it is inherited and runs in families. Birth complications and older paternal ages have been linked, but the evidence does not support their causality. Men and women tend to develop it between their late teens and early 30s, but the peak onset age for both is early to mid-20s. For men in the late 20s for women. Antipsychotic medication is used to treat schizophrenia. It is intended to completely resolve symptoms, but that rarely occurs due to the mental toll it takes. The medications reduce the negative symptoms, but in my experience, the positive symptoms remain at some level. Some of the newer antipsychotic drugs also help with the positive symptoms. However, social skills training can help with some of these things, such as eye contact and improving your conversation. That's the short version of schizophrenia. Spread the knowledge with this video, and feel free to get in touch with me in the comments. However, please remember, I cannot diagnose you in the comments. Besides, you don't want someone online diagnosing you. Anyway, a doctor needs a lot of information from you to make a diagnosis. If you suspect that you have this problem, you should see a psychiatrist. See you next time.